Estimates put China's number of active smartphone users between 600 to 700 million people. It's a market that JP Medical hopes to leverage in order to provide more efficient care to its patients. Will this area of business promise enough opportunities? Let's take a look.
This is the My Doctor app, JP Medical's most recent healthcare software. Using this app, members can conveniently consult their family doctor anytime they like.
Our advantage is that you only have to speak with one doctor, who will then connect you with other doctors if necessary. This generates trust.
With the spread of smartphones and pads, apps have become a focus area of many Chinese businesses. Numbers from the Ministry of Industry and Information Technology show that by March 2013, there were almost 1.15 billion cell phone users in China, more than in any other country. JP Medical is not about to let this opportunity slip. In 2014, working with an IT company, JP Medical created the smartphone app, My Doctor.
This technology is great, and there are a lot of medical apps out there. But many developers make them too IT-like. We're completely different. Our starting point is the doctors. It must be convenient and practical for the doctors to use.
This app has allowed JP Medical to provide more efficient service, but the company is not stopping there. JP has less than 40 general practitioners serving an average of 300 clients each. The lack of general practitioners is a major problem in China. According to numbers from the National Health and Family Planning Commission, China only has 7.3 general practitioners per 1,000 citizens. This accounts for only 3.5% of all doctors as of 2011. In developed countries, this number is usually between 30 to 60%.
Because family doctors work closely with their patients, they need mobile equipment. The members should be able to operate this equipment themselves, to test their blood pressure and so on. Our family doctors also need portable ultrasound and electrodiagrams.
In order to take their service one step further, JP Medical has developed equipment for long-distance treatment. This allows clients to monitor his or her own health, like their blood pressure, and send data to the clinic for the doctor to examine in real time. The use of simple equipment like this reduces the need for the doctors to make home visits.
Long-distance treatment has brought us closer to our patients. It has also greatly increased the efficiency of our services. If patients had to come here, or the doctors had to go home to the patients, one day would not at all be long enough to cover more than a few patients. With this new equipment, the doctors can cover a lot of people quickly.
It is this focus on technology and service that has given JP Medical its advantage. The company now provides medical services to many of the biggest foreign companies operating in China.
Right, so again, Professor, there are an estimated 600 to 700 million smartphone users here in China right now. But again, I mean, mobile health, that might not be catching up right now in China, still might take some time. Do you think JP Medical, it's worth their time right now to invest more in, say, information technology and mobile health to sort of boost their services?
Right. Well, I think mobile health has become a very hot investment area since last year. And this entire market is expected to grow into about 12 billion RMB in the next few years, representing a cumulative annualized growth rate of about 70%. So this is a emerging niche market, but it's growing very fast. In fact, last year I personally have seen several startups in the mobile healthcare sector, and this year we're seeing several high-profile venture capital investment deals, into this niche market as well. So in fact, BAT, the internet giants, Baidu, Alibaba, and Tencent, they actually all announced investment plans into mobile healthcare. And Tencent, for example, I think just a few months back, announced a $70 million investment into one of the leading players in China's mobile healthcare sector, which is Dingxiangyuan. Right? So you can see this is the general trend going into the future.
Mobile health, still a blue ocean environment here in China. Lots of opportunities for different ventures, obviously. What are some of the challenges for startups in this niche market, do you think?
Right. Well, I think the number one challenge, or the biggest challenge, is team. Mobile health is essentially mobile plus health, right? So you need a team of professionals who understands both the internet world and also the healthcare world. Another challenge I can think of is actually revenue models. So as you mentioned, mobile health is still a blue ocean, right? So most startups in this world, they're still trying out different business models and see which one is going to work out. So most of them are still in the stage of accumulating users, right? And they're not really into this revenue stage yet. Right? And a third challenge is actually policy. Currently, there's still a lot of policy restrictions imposed on mobile health. So for example, if you're a startup company trying to provide long-distance treatment, currently, if you're in China, your doctor's in the United States, the doctor only has consultation rights, right? So he or she cannot really do any diagnosis or do any prescription. So these are some of the policy restrictions.
Well, it certainly is a very attractive and enticing market. We'll see how long this blue ocean market will turn into a red ocean market. Many thanks for your insights today on JP Medical, Professor.
Well, thanks for having me.
All right, and on that note, we end this edition of New Money here on CCTV News. I'm Michael Wong. We'll see you again next week.